Britain banned buttock augmentation for 4 years, but they just lifted that ban, and let's find out why. Hey Doc audience, I'm here with world famous buttock augmentation surgeon, but also educator, innovator, and researcher, Dr. Dan Vecchio. Dan, in Britain, they just lifted a ban on buttock augmentation. It's been scrutinized across the world for safety reasons, patient deaths, but you've been instrumental in not only educating surgeons for many years and making it safer, but there's been some breakthroughs recently. Tell us about this.
Well, 4 years ago, there was an unfortunate event where a patient from London went to Turkey, had a BBL, and unfortunately she died of one of these pulmonary fat emboli. And in response to that, the government and the plastic surgery societies in the UK decided to ban BBL in the UK. What that did, I'm not quite sure, because patients still went to Turkey and other places and had surgery. But over those 4 years, we did a lot of research, Bill. In the United States, a lot of people, a lot of really great US surgeons got together, started doing some research, and we figured out why it was happening. And more importantly, we figured out how to stop it from happening. And that's using ultrasound. And now we think the mortality for BBL should be less than tummy tuck. It should be that of liposuction, basically, which is like 1 in 50,000 cases.
So what are you doing? Like, tell us a little about the new technique and how ultrasound fits into this.
So the old idea of ultrasound was, you'd have to follow the cannula, and it'd be like if you and I were in one of those three-legged races, we'd be running down the way with our legs tied together. You just can't follow the cannula. But if you just put the ultrasound down and put the cannula in the right place and just inject the fat actually migrates on its own. You don't need to move the cannula, and we call that static insertion. And when you do that, you actually get a better looking butt, because the fat just kind of fills up like almost like, remember with Jiffy Pop when you were a kid, the Jiffy Pop, like aluminum would like expand up. It just grows out, and you use less fat, it's faster, and it's much safer. So we're really excited about it.
But even in states like Florida, they've implemented state mandated guidelines, which includes exactly what you're talking about.
Yeah, so Bill, you were the one who really pushed us to do this, and hats off to you. But we established the guidelines, and we looked at, Jeff Kenkel and I looked at deaths in Florida. We looked at the days of the week. We noticed that the majority of the deaths happened on Thursday and Friday. That was associated with fatigue and distraction. We know surgeons in Florida do 7 or 8, 9 cases a day. One surgeon had a death at 8 p.m. It was his 7th BBL. So we recommended 3 cases a day, ultrasound in all cases, and really importantly, the surgeon does the lipo and the fat grafting. And a week after we published that paper, the state of Florida passed an emergency order to implement all 3 of those.
That's really full throttle stuff. You've really changed the world in terms of how they approach this procedure. And if you like this, check out this buttock augmentation roundtable on the Plastic Surgery channel.